Hey guys, welcome to my YouTube channel. In this video, we are going to discuss about health insurance definition and how does it works. So let's get started. Health insurance. Health insurance is a contrast between a company and a consumer. The company agrees to bill all of some of the insured person's healthcare cost in return for payments of monthly premium. The contrast is usually on 1 year agreements during which the insurance will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventive care. Health insurance agrees in the US generally come with expectations to coverage including first of all a deductible that require to consumer to pay certain healthcare costs out of pockets up to a maximum amount before a company coverage begins. One or more co-payments that require to consumer to pay set share of the cost for specific services procedures. Here are the different key points in the health insurance. Health insurance pays most medical and surgical expenses and preventive care costs insured by an insured person in return for a monthly premium payments. Generally, the higher the monthly premium is, the lower the out-of-the-pocket cost are the insured. Virtually all insurance plans have deductible and co-pays, but these out-of-pocket expenses are now capped by federal law. Since 2010, the Affordable Care Act has prohibited insurance companies for denying coverage to patients with pre-existing condition and has allowed children to remain their own parents' insured plan until they reach the age of 26. Medical, Medicaid, and the Children Health Insurance Program (CHIP) are federal health insurance plans that extended coverage to older, disabled, and low-income people. How insurance policy for health works? So in the United States, health insurance is a tricky to navigate. It's a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. All about Americans' health insurance coverage as a employment benefit with premium partially covered by the employer. The cost to the employer is to tax deductible. The payer and the benefit to the employee are tax free with certain expectations for S corporation employees. Self-employed peoples, freelancer and gig owners can buy insurance directly on their own. The Affordable Care Act of 2010, commonly called Obamacare, mandated the creation of national database called Health Care Government, which allows individuals to search for standard plans for private insecure that are available vary their life. The cost of coverages and supplies taxpayers whose incomes are below the federal poverty threshold. Some but all the states created their own variants and healthcare.gov. They are trailed by their residents. Retirees receive federal subsidization care through Medicare and families whose self-reported income where the lowest income brackets are eligible for subsidized medical coverages. Here are the different type of health insurance. Health insurance can be tricky to navigate in the US, so-called managed by insurer. Plans require policy holders to get their care from a network or designated healthcare providers. If patient seeks care outside the network, they must pay higher percentage of cost. The insurance may even refuse payments outright for service obtained out of the network. Many managed care plans, for example, Health Maintenance Organization (HMOs) and Point of Services Plan (POS), require patients to choose primary care physician whose cover oversees the patient's care, make recommendations about the treatment, and they provide referral for the medical specialist. Preferred Provider Organization (PPOs) by cost and don't require referral but do set lower rates for using in-network practitioner and services. Insurance companies may deny coverages for certain services that were obtained without pre-qualification. They may refuse payments for name brand drugs if a generic version or comparable medication is available at a lowest cost. All the rules should be stated in the material provided by the insurance company. It's worth checking with the company directly before incurring a major expenses. So, what are copays, deductible, and Coinbase? Most health insurance plans require their customers to pick up the sum of the cost of the coverages in various ways. The deductible amount of this customers pays out pocket every year before insurance going to be meet the cost. This is now capped by federal law.